to my channel. My name is Anu Adekule, a YouTuber from your state, Nigeria. I film about mental health, lifestyle, and events. And if you're a new subscriber, I want to say thank you so much for tuning in. And please don't forget to click on the notification bell. If you're a returning subscriber, thank you so much for coming by.
You give away for permanent subscribers like us.
Like who?
Like me.
And who?
And every other person.
Please, can you just ignore his part and then let's move on.
Okay.
So, as you can see, we have a guest today. If you can remember, I promised us that I was going to bring. Okay, I think before you introduce yourself first, I want you to tell me the difference between an optician, an ophthalmologist, and optometric, or what they used to call it. And I want you to now tell us which one you are.
Optometric. What's optometric?
Optometric.
Ah.
I beg, guy.
How much are you paying to know this?
Please, can you just introduce yourself?
Okay, my name is Adibowale. Adibowale Adibayo. I'm an optometrist. I work in Ibadan, and I've been privileged to save her sight on many occasions. So that's why she considered me. Enough of that, dude. Okay, like I said, my name is Adibowale, and I'm an optometrist. And she has asked the differences between an optician, an optometrist, and an ophthalmologist, because a lot of people make this confusion.
Because the truth is, I don't know it.
Okay, people say I'm going to get my pair of glasses. I want to go and see an optician. I want to do this. I met an optician, this and that. So first, we start from the optician. Okay, an optician is a very important part of the eye care, and they basically are technicians that helps to fit and glaze lenses into frames. So you get the prescription from your doctor, and the optician gets the lenses and puts these lenses into the frame. Then an optometrist is a doctor of optometry. He's not a medical doctor. He receives a doctor of optometry degree. In Nigeria, optometry is for 6 years, and 1 year of internship and 1 year of NYC. So making 8 years.
NYC is not counted as part of anything.
Of the training. Thank you.
So it's just 7 years.
So is for 6 years and 1 year of internship, and the person receives a doctorate degree in optometry. So he's a doctor of optometry, and the person at the primary care level is able to examine, is able to detect, is able to treat and manage eye conditions that do not require surgery. So on the ladder of eye care services, the optometrist is the gatekeeper, so to say, because he's the primary care specialist that then refers for conditions that requires surgery. So an ophthalmologist is first a medical doctor who has studied medicine and has now undergone residency training in treatment of eye diseases, who has undergone residency in ophthalmology. So you study medicine, you graduate as a medical doctor, and you go for a residency program, which depends on your training facility. So some persons can take them about 4, 5, 6 years, depending on how the training goes for them. So he graduates, becomes a consultant ophthalmologist. So when you go to teaching hospitals, you find an ophthalmologist and an optometrist working hand in hand. But in most teaching hospitals, you find an optometrist very much in charge of the refraction. However, in other healthcare services, usually the optometrist receives the patients examines, treats, uh, and when necessary, refers to an ophthalmologist, especially in cases that are more advanced and cases that requires surgical interventions. So that's the difference between an optician, an optometrist, an ophthalmologist. An optician doesn't examine the person's eyes. An optician doesn't do anything as a form of intervention for the patient. Rather, the optician gets, when you go to an optometrist or an ophthalmologist and you need a pair of glasses, the prescription is what the optician works on to get you your glasses. For example, I use a pair of glasses and I saw an optometrist, I did an eye exam, the optometrist gave me a prescription. So the prescription is what the optician sources out and gets the lens, then glazes it into the frame to make the pair of glasses.
Wow.
So say thank you.
So all of us that
Say
we
thank
don't,
you
please.
before we proceed.
That's proud.
So I am an optometrist. I finished from University of Benin a few years ago. So I work as an optometrist in Ibadan.
Pride.
It's not pride, it's enlightenment.
If we talk about standard eye examination, what do you think it entails?
Okay.
Because I've heard lots of people say that, okay, like when I had issues with my eyes, like I only went for eye examination once, and that was when I was moving book closer to my eye, and my mom felt, okay, it wasn't nice, that probably I needed a pair of glasses. But when I did the eye examination, I was told nothing was wrong with me until everything became
Back down.
and then I came over to yours, and then I found out what was wrong and things worked out. So what does a standard eye examination, what does it entail?
Okay, a standard eye examination first should be from seeing the right person. So if you are not seeing the right person for your eye examination, chances are that you are not going to get a correct eye examination. So when you go for an eye examination, be sure that you are seeing either an ophthalmologist or an optometrist. Okay, so when you see the doctor and you make your complaints, of course the doctor should take what is known as a case history, because this forms a baseline of the things that are wrong with the person. So the doctor takes your case history, asks you questions about what is wrong with you, asks you questions about your past ocular history, if you have used glasses before. For example, if what is wrong with you currently has happened before, if this is the first time or not, when your last eye exam was.
If I can't remember anything, I remember that I kept asking me something about family history. Does your father have?
Of course.
Does your mother
Your
have?
family history has a major. It has a major
Your
part to
grandmother?
play.
And I'm like,
Your family history has a major part to play in whatever is going to happen to you. For example, your complexion, your kind of eyes. I think you got it from probably your mom or your dad.
no, I'm in the middle.
Okay. But in the middle shows that your mom gave you some part, your dad gave you some part. So also in diseases, you inherit some parts of diseases from them, most likely. You inherit some parts of good things from them, most likely. So your family history also comes into play. And also your social history, the kinds of things you do, your vocation, and how you relax.
Our power holding people.
Okay.
We call them
Power
NEPA.
holding.
We call them NEPA, IBDC, but it's not working.
It
They
shows
tried
you're
it.
Nigerian. It
It
shows
shows,
you're
yeah.
proper Nigerian.
Yeah.
If light doesn't go off, what makes you Nigerian?
We don't do that. They gave us light for a full day, and then I
You're
went.
afraid.
I can't sleep. Please let them just take this. Like we don't want, because 3 days time
You'll be afraid.
we might not smell like. So please, you were talking about family history.
So I said your family history has a big role to play. So if you go to an eye, not taking, chances are that you may not have a very good diagnosis. So if an information is missing, it could make or mar your diagnosis. For example, a patient comes in and during the examination, the doctor finds a particular sign, and the doctor asks you, did you do any of these things, or are your parents, do you have any history of glaucoma, for example? That could speed up the diagnosis of the doctor, because we know that positive history of glaucoma predisposes the children to having glaucoma. So if a person comes and says that nobody has glaucoma, the doctor would likely doubt a diagnosis of glaucoma he or she may have made before. So your family history has a very major role to play. Also, when you go to a doctor, you have a lot of discharges, and the doctor asks of your sexual history, and you lie that
discharges from the eye,
and your doctor asks,
in relation to sexual history.
Of course.
Wow.
And your doctor asks about your sexual history.
That's new.
For example, the person has maybe gonococcal conjunctivitis, and you deny that you're a virgin. You have never seen a girl or a guy in your life before, and the doctor is looking at copious mucus discharge from your eye. The doctor will begin to doubt, then what exactly are we looking at? So the doctor would have to take his mind to other things that may be happening. But if you are very truthful and your doctor also takes a very good case history, the doctor goes straight to his diagnosis, and it's good for the doctor, it's good for you. So your case history should be taken, then how well you can see in terms of your visual acuity. This is taking that, I believe a lot of people should have done this, maybe in your school, during your pre-employment, or during your medical screening when you got into university. They ask you to look at some letters from a particular distance.
We did that.
So
I think almost
you
everybody
get to
did
look
that.
at it. A lot of people may have done that. So you still have to do that, although these distances will be very well measured, and that will tell us how well you're seeing. Because if a person comes into the clinic and says that my vision is blurry, we should be able to quantify how blurry your vision is, because taking your case history, taking your visual acuity will tell us how we intend to treat you. If you came in with a blurred vision and you're leaving the clinic with a more blurry vision, that's a minus. And also there are cases whereby people come, they say that when I came to your clinic, this was the way I was seeing, and after you gave me these certain drugs, I wasn't seeing the same way again. This visual acuity could be very useful in litigation cases, so that, of course, we are not like that in Nigeria, but in other countries, you could be sued for anything. So a patient comes to you now with a particular vision, you tell, when you were coming into this clinic, this was the way you were seeing, and it's on paper. So it helps us to know how well you're seeing, and we quantify the level of vision you have. Then you also look into the eye to see the structures of the eye, how the front part of the eye is, then how the inside of the eye also is, to be sure that it is fine. So when you do that, you use either an ophthalmoscope, or you use, I wish I could show you pictures of that, either an ophthalmoscope, or you use a slit lamp to examine very well. Because if you don't do these two things, you won't really know. I can't look at your ocular structures with my naked eye, because your blood vessels are very tiny. And also you check the pressure in the eye, which is a very, very important aspect of examining people's eyes. You look at the pressure of the eye. Normal pressure in the eye is between 10 millimeters of mercury to 21 millimeters of mercury. It's just like you go to the hospital and you don't check your blood pressure. Who goes to the hospital without checking your blood pressure? Okay, so you check the person's intraocular pressure, because it's just like a normal vital sign in your body. So the intraocular pressure should be between 10 to 21 millimeters of mercury. So that will tell us Usually it will indicate that there is either ocular hypertension or glaucoma. And if the pressure is very low, it could also indicate that the person may be having a retinal detachment. And of course, a retinal detachment is an emergency. Yes, it's an emergency, but before the person, more than the pressure the person notices, there are lots of signs that the retinal detachment will have given the person. So your case history is that for hair. That's deeper than this. So for cases, when you go to an eye clinic, you make sure that a thorough case history is taken, because that will help the doctor to know exactly the things that are wrong with your eye. And secondly, your visual acuity, how well you're seeing, is also noted. And thirdly, your intraocular pressure should be done, and the structures of your eye should be well examined. So this forms, I just hope I'm not missing anything out. This forms a basic eye examination. Then from there, the treatment procedures could now be undertaken. Maybe you need a pair of glasses, that could be done. Maybe you need a dilated fundoscopy, that could be done. Maybe you now need some drugs, that could be done, and the likes. But the basic ones you should do: your VA, your IOP, your ophthalmoscopy or fundoscopy, and your, what again? Just remind it, you remember. So these are the things that makes up a basic standard eye exam.
Thank you very much. So to the next question, how often should you see your doctor?
Well, you should see your doctor. For example, let's take it from babies. Your baby should have his or her first eye exam at 6 months.
Wow, that's
Because
new.
that is the formative year. And there are some things that, if they are not detected early in a child, a baby, for example, it could really affect that baby. For example, if a baby has a cancer in the eye, like a retinoblastoma, you're most likely going to know from the baby period, that infancy period, such that when you shine light into the patient's eye, you should have a red reflex. But if you're not seeing a red reflex, you're seeing a white reflex. That's a very big sign.
How are we going to know this is why white or red?
As a child, as a mother or a caring guardian to your child, you should be able to play with your child. You should know some things. Shine light into your child's eye. If by play or by intention, shine light on the person's eye. Shine light, let the child try to reach out for that light in your hand, because these are subtle ways in which you can be able to detect if your child is seeing or not. That's why a child of 3 months would allow you to carry her, anybody to carry her. But a child of 6-7 months will not allow the same thing. Only oti moju, mommy and daddy, because the child is growing. The child is already forming, there's a visual development that is going on. So if you're not seeing those things in your child, you should get your child examined as soon as possible. If they bring the lights, suddenly the light comes up in the house, your child at that moment should look in the direction of that light. If you're holding a torch, your child should be able to fixate on that light and follow the movement of that light anywhere the light moves. So when you go to the eye clinic at 6 months, all those things are checked appropriately and the visual development goals are also assessed. Then the next one, from your 3rd year, your 6th year, then as you like. However, it's expected that for people who are below the age of 40, you should see an optometrist or an ophthalmologist once in 2 years.
Once in 2 years? For people below 40.
If you are above 40 and there is nothing wrong with you, if you are above 40, you have no systemic ailment, you have no disease or anything, you should see him once in 18 months. Because from 40, everybody develops presbyopia. You find it increasingly difficult to read tiny print. You prefer to push it further away from you. So from there, you would need a reading pair of glasses. So that glasses should be changed at most between 18 to 24 months. So you can use that opportunity at every interval you want to change your glasses, you should see a
I don't
doctor.
know.
But if you have a systemic history, probably like you are hypertensive, you're diabetic, you have a family history of blindness, or you have a family history of glaucoma, either you are below 40 or you are above 40, you should have a yearly dilated eye examination, especially for people who are diabetic or who are hypertensive, because your systemic history, the diseases in your body, have a way of showing forth in your eye. You can't see your blood vessels, can you? But when you look into the eye is the only organ through which you can you can visibly see, if that is correct. You can literally see, yes, that's a better word, all the blood vessels and how the blood vessels are working and what is happening in the health, in the body of the person. So, for a person who is diabetic, and you've not seen an eye doctor in the last 1 or 2 years, you are doing yourself. Do you understand? So, once in 2 years for people who have nothing wrong with them in their bodies. But people who have a family history of glaucoma, people who have a family history of diabetes, or they themselves are diabetic, they are hypertensive, you should see your doctor once a year.
Yeah, that was going to be the last question for this part, because actually this segment is going to be divided into two parts. The first part, which we are doing now, is where we ask general questions, and then the second part is where we'll be asking frequently asked questions, questions about makeup, questions about contact lens. So you don't want to miss the second part at all, because it's really going to be as interesting as this part, even more interesting. So I wanted to the last question to be about people with illness, people with diseases. How often should they see the doctor?
I just mentioned
Which
that.
you just did.
Yes.
And then I think, do you have any other, what's the name called, you want to add to it?
Oh, just generally, because from your eye, you could detect more than 30 eye diseases. I've detected hypertension, diabetes,
Eye disease or
or body
disease?
diseases rather. People who have rheumatism, arthritis, you can detect it in the eye. People, a lot of things, a whole lot of things that at the moment I can't really remember now, but having a yearly dilated examination would save you from a lot of things that could otherwise be preventable and could be deadly.
So thank you very much. So with
Thank you.
this, we've come to the end of this part. So you are seeing this now, and the other part I would be releasing or vlogging, or how do they put the English now,
Anyhow,
on Sunday. So you don't want to miss it. We'll be talking about questions that you yourself want to ask about contact lens, makeups, and everything that you need to know about your eye. So until I see you with him again on Sunday.
it's me on Sunday.
On Sunday,
All right.
bye.
Thank you.